Hello,
Yes, ma'am, you can start.
I can. Okay. Good afternoon, everyone. I'm Dr. Anitha, fertility specialist working here at Motherhood Whitefield. My topic for today is preparing for your IVF journey. There are many people who come to us seeking fertility treatment, and they always ask me, ma'am, how do I prepare for my IVF journey? So here I am to give you certain inputs and help you with your IVF journey. So every couple wants to hold their bundle of joy, but few of them face unforeseen challenges like fertility issues, which makes them seek this treatment of IVF in order to have a baby. So, what is IVF? IVF is a process of fertilization where an egg is combined with sperm outside the body. So, as you know, preparation is a key to any success. So, here I am telling you that what is the importance of preparation. So, emotional, physical, and a financial readiness can significantly impact the success and experience of your IVF journey. Again, I would like to elaborate a little about what is the procedure again. IVF is a procedure used to help with fertility or prevent genetic problems. And of late, we also offer this kind of treatment to people who want to preserve their fertility and assist with the conception of a child in the future. So, what are the basic steps involved? So, to start with, you are given certain fertility drugs. It can be injections, tablets to stimulate the ovaries to produce multiple eggs. So, once the follicles are monitored, so the eggs are retrieved through a minor surgical procedure to collect eggs from the ovaries. The collected eggs again are mixed with the sperm in the lab to create embryos. Then one or more embryos will be placed back into your uterus, hoping for a pregnancy. So, how do you prepare for this? So, there is a physical preparation, there is an emotional preparation, and a financial preparation, I would say. To start with, let's start with the physical preparation. So, you will need to see the fertility specialist, and then he or she will review your medical history, ask you to do certain tests for both you and your partner to check your fertility. And there are certain screening tests done to rule out any infectious diseases like HIV, HPSAG, HCV, and a VDRL test will be done to all the couples. Then, depending on the results, there will be a treatment plan which will be personalized to you and your partner. There are other things that can help in your IVF journey, like your lifestyle changes. Having a balanced diet rich in nutrients, regular exercises tailored to your fertility health, and avoiding certain harmful substances like alcohol, smoking, and excessive caffeine can impact your fertility journey. So, avoid these harmful substances. And again, coming to the body weight. So, achieving a healthy BMI can improve your IVF outcomes. Being underweight is also not good. Being an overweight is also not good, which being underweight and overweight can imbalance your hormones, resulting in disruption of your menstrual cycles. It may hinder your ovulation and the fertility uh, process. So, aim at having a BMI anywhere between 19 to 25. That's the ideal BMI. Cannot always get the same BMI, but at least losing weight and reducing your BMI helps in having a successful outcome in your IVF journey. The next important thing, once you have been told that you need to undergo an IVF treatment, so understanding the cost of the treatment is very important so that you can be stress free when you're undergoing the process. So understand what all costs you're going to incur. You can have a breakup with the counselor, asking what will be the consultation fees, what are the medications, how much do they charge for that, what are the procedures involved, um, and what will be the follow-up visits. So each and everything should be understood by you. There can be additional treatments advised, like sometimes if you are going in for a pre-genetic screening, that will be an extra cost, and understand how much is the cost for those procedures. And in case you have surplus embryos, so maybe we will not use all the embryos, so you can opt for a freezing process, or if you're not willing, they will discard those embryos. So you need to understand what all costs are involved and be prepared for it, so that you can be stress free and focus on the IVF treatment. You can always check with your insurance provider what is covered and what is not. So most insurances nowadays are covering part of the IVF, and the rest you will have to pay. Or also, if you're not have the insurance is not covering your IVF treatment, there are other programs where you can ask for assistance through loans and payment plans available for IVF. For example, Bajaj is a very famous, or I would say the most sought out mm, program, where they are giving you zero payment and EMIs that you can ask for. Coming to the emotional preparation, this is a very, very important preparation, I would say. As you know, IVF is an emotionally challenging process where you can go through a lot of emotions. So understand that it's normal to feel a range of emotions. So to combat this, you can opt for a counseling, or joining a support group can help. So the other support systems that you can seek for is from family and friends. And also you can avail professional counseling services. Set realistic expectation and be prepared for all the possible outcomes. It's not that once you go through an IVF, you will be blessed with a baby. No. Even with an IVF, where we put a small baby inside, we cannot guarantee a pregnancy. So be prepared for multiple cycles and be positive in your thoughts, so that this also has a good or a better to have a better outcome. Now, choosing the right clinic, what factors would you consider? So always ask for the clinic success rate, see where it is located, nearer the better, so that you need not travel long, and ask for all the facilities which are available and staff qualifications. So having said this, the success rates are not the same. The success rate in the national forum is about 40%, and this success rate is varies from center to center, and it's dependent on the age of the woman, the cause of the fertility, and the what kind of procedure we are doing. So in a self cycle, there may be a lesser chances, but with a donor cycle, we say the chances are more. But as such, we don't do donor program for every patient. Only when it is indicated, and when they are not able to have their own, they are being told to undergo these procedure, undergo donor egg program or a donor sperm program. Ask the right questions. So you can ask the clinician, what are the procedures you will be undergoing? What is your what could be your outcome, depending on your age and your health condition? What are the treatment options available for you, and what else you can do to have a healthy pregnancy through IVF? Patient testimonials and reviews. I think I need not tell all these, because all of you would look at reviews and testimonials from other patients in order to choose the IVF clinic. And there are certain legal and ethical considerations. So understand the legal aspects, like you will be asked to sign certain consent forms. Please read the consent forms and always be informed about why uh, certain treatment has been advised to you, what could be the possible outcomes, and what should you expect out of it. And there are certain legal implications of IVF, like in case you're going for a donor egg program or a donor sperm program. So there will be some legal aspects that you need to look into, where you will be asked to get a affidavit for undergoing these donor egg. The third party production has to undergo this kind of an affidavit. They should bring that because they will be going to go through the procedure. And there are certain ethical considerations, especially when it comes to embryo disposal and genetic screening. So when you are having surplus embryos, you'll be asked to freeze your embryos. So in unforeseen cases where one of the partner dies or they are divorced, so what should the clinic do about those embryos? You need to give us a consent. So what do you want to do? To discard, to hand over to your spouse, or give it to for academic purpose? And even through genetic screening, there are chances that when we do a genetic screening for your embryo, not not all can come out good. There are times where we need to discard your embryos. You need to give us a consent for that. Now, I would like to briefly tell you what will be the IVF timeline from your initial consultation to the pregnancy test. What we do can be around 5 weeks, I would say. To start with, you'll have an initial consultation, and there'll be hormonal stimulation, which will be given so that you produce more eggs. Minimum of 10 to 12 days of injections will be there, and you'll be called for multiple scans to monitor your follicles. And once we see a follicle is mature, then you will be asked to do certain blood tests to correlate how many eggs we may get. And according to that, we will be giving you a trigger injection. And 36, 34 to 36 hours from then, you will be asked for come for a egg retrieval procedure called the OPU. And that will be a day's procedure. And then once the egg is retrieved, there will be a sperm collection done from your spouse, and the egg and the sperm are made to meet in the laboratory, and we will grow them for 3 to 5 days. And then once the embryo is formed, and when it reaches a blastocyst stage, maybe an embryo transfer will be done on day 3 or a day 5, depending on the situation and the number of embryos that we get. And the grading will be done for the embryos, and the best embryos will be transferred. And then comes the waiting time, that is 2 weeks after the embryo transfer. We will be doing a pregnancy test, that is the beta HCG, to know the outcome of your IVF journey. There can be physical and emotional changes at each stage that you go through this procedure. Some of the medications and side effects that you can expect are: the common medications that we use are gonadotropins, GnRH agonists, and antagonists. So these injections may cause certain side effects like bloating, mood swings, headaches, and sometimes if it is a case of a PCO, ovarian hyperstimulation syndrome is a very common side effect which happens. But in the present day practice, we aim at not having an OHS, and we would aim at having OHS free clinic, but sometimes it's not in our control. We do have OHS once in a way, and we are always equipped to treat those complications. So for managing these side effects is through regular monitoring and keep communication with your healthcare provider. So you may be asked to take certain medications to overcome those side effects. Or sometimes when you have an OHS, you will be asked to come to the hospital more frequently. Blood tests will be told, scans may be done, and certain medications through IV injections will be given to suppress the hyperstimulation syndrome. Coming to lifestyle and diet tips, as you all know, maintaining a healthy diet is very important here. And so you need to focus on eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. And also have supplements like folic acid, vitamin D, and omega 3 fatty acids. Also, prioritize your sleep, and also you can do stress reducing activities like yoga and meditation. Here again, I would like to stress upon your partner's role in your IVF journey. Always, I would tell the menfolk, be present, listen to her, provide reassurance to her, which is very, very important for her to go through this process. Participate in the appointments and be involved in every decision making. So when you're going through this, I know both of you may be for having certain uh, um, hormonal problems which will cause more stress, and you can seek support and always maintain an open communication. Coping with the setbacks. So this comes when you have a failed cycle. Always learn to deal with the failed cycles. Acknowledge feeling of loss and disappointment. You can always have a counseling, and also have, you can manage this emotional journey through support groups, where there are people who like you have undergone these procedures. Some have succeeded, some have failed. They do have their inputs how to go about with the next procedure. So once you have heard all this, you can consider sometimes when you're not able to conceive, maybe twice, thrice, you can consider other alternatives like donor eggs, sperm, or surrogacy, or as a last resort, adoption. Some of the success stories which we have had, there are many babies, many women who have gone through treatment with us, and here are those feedback from our patients. And these are few babies that I have delivered over the past few years. My bundle of joy. In conclusion, I would say preparing for an IVF requires an emotional, physical, and a financial preparedness is important for an IVF outcome. So I hope I have given you a few tips and insights about the program, and feel free to ask me any questions you have. Thank you.
Hi, doctor. Once we receive the questions on our chat on YouTube, we'll
Yeah.
forward it to you
Yeah.
so that you can answer them.
Okay.
Thank you so much for your valuable time.
Thank you.